A tragic milestone in the opioid crisis. The CDC confirming drug overdose deaths hit a record high in 2021. 107,000 Americans died from overdoses. That is an average of one death every 5 minutes. Drug overdoses are now the leading cause of injury-related death in the United States. Many health experts believe the COVID-19 pandemic worsened the crisis in many communities. Joining us now to discuss this urgent crisis is Dr. Yalda Safai. She is a psychiatrist based out of New York City. Thanks for being here. Drug overdose deaths hitting their highest level on record, 50% higher than the year before, 2/3 of those involving fentanyl or other synthetic opioids. What is going on?
Okay, so thank you for having me. The opioid epidemic really progressed in 3 phases. The first phase started in 1990s and involved mostly prescription opioids. In 2010, we had the second phase and we saw an increase in heroin use. It wasn't until 2013 that we really started to see an increase in overdose-related deaths due to fentanyl, which is about 50 times more potent than heroin. A growing share of the deaths we see today continue to come from overdoses involving fentanyl that is oftentimes mixed with other drugs such as methamphetamine. Now, fentanyl is a white powder. It can easily be combined with other drugs such as heroin, cocaine, methamphetamine. It can even be stamped into counterfeit pills such for anti-anxiety medications such as Xanax. Now, because fentanyl is so much cheaper and easier to produce and distribute than heroin, it makes it more appealing to traffickers and dealers. But because it's so strong and potent, even a small amount can mean the difference between a user getting a normal fix and a fatal overdose.
And we're hearing about a lot of kids and college age people who are thinking they're doing other drugs, right? And then they're overdosing on fentanyl.
Correct. So nowadays, a lot of the drugs such as cocaine and methamphetamine are being cut with fentanyl because, like I mentioned before, it's pretty cheaper than heroin. So a lot of times you think you're doing methamphetamine or cocaine, but really you're doing methamphetamine that's laced with fentanyl. And for a fentanyl naive person, even a small amount is enough to result in an overdose.
And is methamphetamine itself, is that making a comeback in this country?
It depends on the region. Mostly we're seeing an uptick of it on the West Coast and not so much the East Coast. But yes, we're seeing more and more use of it across the nation, but mostly in the West Coast.
Okay, and let's move to the pandemic. How has the pandemic contributed to the problem? What are your patients telling you?
Of course. Well, the opioid epidemic was a problem way before the pandemic started. Now, you add the virus and you have social isolation, you have economic pressure, which has been widespread since the beginning of the pandemic. These 2 reasons are enough to cause a relapse in drug use and could have contributed to the rising overdoses. Now, we had shutdowns in early 2020, which also caused some addiction treatment centers to close off temporarily, which meant that users didn't have a place to go to seek treatment or seek help when they needed to. However, all of this can't fully explain what we're seeing today. So the pandemic alone is not to blame for the uptick in overdoses.
And how do you balance, just as a mental health professional and an MD, how do you balance keeping safe from COVID and then also, keeping mentally healthy?
I think once the pandemic hit and we realized that social isolation is not a good fit for people who need social support, who need to see their sponsors, we started doing a really good job at implementing virtual check-ins and virtual treatment centers. However, we still need to meet in person to get our drugs if we're addicted. We need to meet in person to get our treatment for our treatment. So it wasn't an option to just virtually meet with our sponsors. We really had to go in person to pick up our medications. So it became a challenge for everybody. But I think the pandemic made us realize that we need to do better and we need to have better support in place. Even if a person can't physically be in a place, we should be able to reach out to them virtually.
And when we talk about substance abuse, it's really hard for the families too, the loved ones dealing with someone who's battling an addiction. What are your tips for them?
Of course. First of all, it's understanding, first and foremost, just telling the person in the family who's addicted to let them know that they're there in case they need them. Oftentimes it takes multiple detoxes, multiple rehabs for a patient to be able to maintain sobriety. And once a person is addicted, it affects the entire family. So first step is for the family members to just let the person know who's addicted that they are there in case they need them to reach out to.
All right, Dr. Safai, thank you so much for joining us tonight. It's a really important issue. Appreciate your time.
Thank you for having me.
Thanks for watching. Click the red subscribe button below so you can get more of News Nation's fact-driven, unbiased coverage.